Biden administration has announced that it plans to stop buying COVID tests and vaccines as soon as this fall. The move is part of a plan to transition the country out of an emergency response phase. The White House says that it hopes to commercialize almost all COVID-related products next year. It is currently thinking through factors such as regulation and accessibility. Experts are warning of a bad flu season and are encouraging Americans to get new boosters this fall. A new round of upgraded vaccines are expected to become available next month.
And joining us now, Dr. Robert Murphy, professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Well, in transitioning from pandemic to endemic, how is that actually going to affect our day-to-day lives?
Well, what's going to happen is the U.S. government and all the central authorities giving the vaccines, buying the vaccines, buying all the treatment, buying all the tests, sending people tests, that's going to come to an abrupt end, and that's going to happen very soon. The transition they expect is going to be completed by the 1st of 2023, but it's going to start soon.
So you'll have to buy your own tests and pay for all of your own stuff, right?
Right. It's going to be just the stuff will all go, all the vaccines, treatment, and tests will just go into the commercial market. And you're going to have to get a test, just like you get a flu test now. Or if you get Tamiflu for flu, it's the same thing is going to be. Your insurance is going to have to pay, or there's going to be some other type of payment plan involved.
We heard from the CDC that they're planning a major overhaul. They know they just didn't handle things right. How quickly can they turn things around so people, can rely on what the CDC says? They were giving so many mixed messages.
I know, Robin, everybody knows this, and Rochelle Walensky, who's the current director, is completely aware of the problem. In April of this year, she ordered an external review of just the entire operation of the CDC, which is 11,000 people, all right? So this is a big, $12 billion a year enterprise. And I guess the report was pretty tough. And she's taking action plans now, and they're going to restructure the whole thing. It's not set up for a pandemic, and it has to be ready for a pandemic. And she's going to make some real big changes there.
Dr. Murphy, tell us where we are with the Omicron variant here. A new study showing that half the people who are infected with Omicron don't even know it.
Yeah, well, we've shown kind of this data before. In other words, a lot of people get infected, never get tested. They don't know they have it, but when we do the antibody test, we found out that they had it. The same thing actually happened to me. I was in a healthcare worker study in 2020, in the first year of the pandemic. There wasn't even any tests to do. Same thing here. So you're referring to a study done out of UCLA and Cedars-Sinai, 210 employees. So you think like these people, employees and patients, but you think, they would know that they were infected. 75% originally didn't know they had it. And then as the home testing became more available, that dropped down to 56%. So the home testing really improved. It's going to be interesting to see what happens now that people are going to have to buy their own tests.
Before we let you go, let's talk about monkeypox, the vaccine availability. And we heard a dog got monkeypox. How worried should people be about this?
We have to be careful with monkeypox because monkeypox is related to smallpox, and smallpox is really, really horrible. So now we know that monkeypox monkeys aren't even the reservoir. It's rodents. The dog got monkeypox, but it's probably not a carrier. He probably just an unfortunate primate that got it. So we have to be careful with this, and this has got to turn around. So the vaccines are coming forward. They've ordered more. There's more out there. And you can give the vaccine in a different way, just under the skin, like a TB skin test. And you have 5 doses of the vaccine versus 1 that's just given intramuscular, the usual way. So, things are coming around, but this has been another slow rollout, and it's another reason why the CDC has had this review, because, you think with all the experience from COVID, monkeypox would have been kind of easy to address, and it hasn't been.
All right, Dr. Murphy still answers COVID-19 questions Tuesdays on Northwestern University's Institute for Global Health Facebook page, and you can check out Dr. Murphy on the Explore Global Health podcast. Thanks, Doctor.
All right, thank you. Have a great weekend.
You too. Hey, Paul.